November is the annual campaign focusing on men's health, and it provides an important reminder that men's health matters and still deserves attention all year round. This month I want to spotlight two cancers that affect men: prostate and testicular cancer. Both of these cancers, when detected early, can be effectively treated, yet many men delay seeking help. Understanding the risk factors, the symptoms, and the importance of early detection can quite literally be life-saving. Prostate cancer is the most common cancer in men in the UK, and it affects around 1 in 8 men during their lifetime. The prostate is a small gland that's just below the bladder, and it plays a key role in male fertility by producing seminal fluid. Prostate cancer often develops slowly, which means that it may not cause symptoms for many years. By the time the symptoms emerge, the cancer may have progressed, which is why early detection is crucial. Age is the most significant risk factor for prostate cancer. It's rare in men under the age of 50, but it becomes increasingly common as men age. Ethnicity also plays a role, so black men are at a higher risk, with about 1 in 4 developing the disease. Family history is another important factor. A close relative, such as a brother or a father that has had prostate cancer, can increase your risk. Finally, genetics also plays a part. Inherited mutations in genes like BRCA1 and BRCA2, which are also linked to breast cancer, can increase prostate cancer risk. Many men may not realise they have prostate cancer until it's advanced, because early stages rarely present with symptoms, but when the cancer grows, it can lead to urinary problems like difficulty starting or stopping urination, frequent urination, or a weak flow. Some men also report pain in the lower backs or the hips, though this typically occurs in the more advanced stages. Screening for prostate cancer involves a combination of a blood test called a PSA, prostate-specific antigen, and a digital rectal exam. While neither of these tests are perfect, they are helpful in identifying men who need further investigation. There's no formal screening programme in the UK, and NICE, the National Institute for Health and Care Excellence, doesn't recommend routine population-wide screening for prostate cancer using the PSA test. This is because of concerns that they have about the test's reliability and the potential for overdiagnosis and overtreatment. Specifically, the PSA test can detect prostate cancer, but it doesn't distinguish between slow-growing cancers, which may not cause any harm, and aggressive ones that need treatment. So I recommend that men over 50 or 45, if you're at higher risk, have a conversation with your GP about screening options to just better understand the risks and the benefits of PSA testing to make an informed decision. Unlike prostate cancer, which primarily affects older men, testicular cancer is the most common cancer in younger men, particularly in those aged between 15 and 49. Although testicular cancer is relatively rare compared to other cancers, it is important to be aware of it because it affects men in their prime years. The good news is that testicular cancer is highly treatable, especially when caught early. The most significant risk factor for testicular cancer is having had undescended testicles as a baby, a condition called cryptorchidism. Even if this was corrected surgically, it still raises the risk. Other risk factors include a family history of testicular cancer and a personal history of the disease, as it can recur in the other testicle. Unlike prostate cancer, testicular cancer often presents with the more obvious symptoms early on. Men can notice a lump or swelling in one of the testicles, which is often painless. Others may experience a feeling of heaviness or discomfort in the scrotum. If any of these symptoms are present, it's crucial to see a GP promptly. Regular self-examination is an excellent way for men to stay on top of their testicular health. Once a month, I encourage men to feel for any lumps, changes in size, or any unusual sensations in their testicles. This simple routine can help detect abnormalities early, ensuring faster treatment and better outcomes. There are plenty of myths around men's health and cancer, and some believe that prostate cancer is always slow-growing and harmless, whilst others think testicular cancer only affects men with a family history of the disease. But both assumptions are dangerous. Prostate cancer can be aggressive in some cases, and testicular cancer often occurs without any family history. The key is not to ignore symptoms, no matter how minor they seem, and to act early. Another common myth is that if you have no symptoms, you don't need to worry. However, many prostate and testicular cancers are asymptomatic in the early stages, so routine checkups, screenings, and self-exams are essential tools for catching these diseases early. For more information on prostate and testicular cancer, men can visit trusted resources like Prostate Cancer UK and Movember's official website. These organisations provide guidance on symptoms, risk factors, and how to access screenings. Your local GP surgery is also an excellent place to start for advice on screenings and any concerns that you may have about men's health. By raising awareness and encouraging early detection, we can ensure that more men live longer, healthier lives. This Movember, let's remind ourselves that men's health matters.